Today we're going to cover snapping hip syndrome, and what we're going to do is explain to you what it is, who is the most common group that experiences it, what you can do to fix it, and we're going to clear up some misinformation about what the medical community and just generally the online community is telling you to do and why it's incomplete.
I'm Dr. Chloe Costigan.
And I'm Dr. John Giacolone.
And we are co-owners of Mobility Doc.
And co-founders.
Yes.
And husband and wife.
All of the above.
Yeah. And Mobility Doc is a sports medicine company that specializes in not only rehabbing injuries that are sports related, but helping to achieve longevity and sustainability for active lifestyles.
We care about you continuing to do the things that you care about.
Yeah, when people tell you that you should just stop, we're the ones who tell you this is how you can keep going.
We see this pretty regularly. We treat 7,000 patients in a given year, and this is one of the most common things that we end up seeing. And it's really important to remember that there are a lot of layers to really understanding what snapping hip syndrome is, and that's why we want to take the time to go through that today, so then you have a better idea and you're more informed. So what is snapping hip syndrome?
Another name for it, Cox's-Sultans.
Fun fact.
There are two types of snapping hip syndrome. There's one that's muscular and generally called external snapping hip syndrome, and then there is internal snapping hip syndrome, which speaks more to degeneration at the joint level inside of the hip. There's
this incongruency in terms of the way that the two bones of the hip joint are moving or not moving together in this case, which can be causing that snapping hip.
Yeah, so labral tear, free-floating loose bodies of bone, arthritis, like that can be a cause of snapping hip. But there's also this other large cause, which is, I would say, the most common that we see.
Most common, yeah, definitely.
Is the external, which the good news is external snapping hip is in your control and is not a terminal diagnosis for the activity that you like to do.
And also doesn't mean surgery either.
Yeah, exactly. So what does snapping hip syndrome look like? What might you be experiencing to know, like, I've got that?
People regularly will like to kind of test it or try to reproduce it in the office. So it might involve doing something like lifting their leg up and out to the side, or placing their foot down and pushing their hip back. Something typically where your hip moves through a few degrees of motion, a lot of times can reproduce that sensation and even sometimes the sound.
Exactly. And another one that a lot of us maybe have experienced, if you've had the sensation of like a snapping hip before, is you're sitting for a while and then you get out of a chair and like you have that sensation of you're aware it's gonna happen. There's this like stickiness, and then it's like, and then all of a sudden it's gone and you're moving around. But there's that moment before the snap that's quite audible where you're like unsticking from the seated position. All right, so we're gonna deep dive a little bit into Dr. Chloe's favorite part here, which is she's going to nerd out what is the technical breakdown of snapping hip syndrome.
Okay, so when we talk about snapping hip, let's orient ourselves to the hip joint. So here is your pelvis, here's that femur. So when we talk about internal snapping hip, what we're talking about is something within this joint, okay? So here's the outer edge of the hip. When you put your hand on the outside of your hip, this is a lot of times what people are actually touching. Here is the actual hip joint in here. It's kind of like in the crease of where you sit, which you can see here. Now, when we talk about the external factors that are contributing to snapping hip, here is this iliopsoas that comes down in the front of the hip. So it attaches and right in through this like inner part of the leg. What happens is that when it goes over top of this joint, its fibers are kind of continuous with this joint capsule. What ends up happening is that when this whole area kind of shortens, then it kind of prevents this part of the joint from moving a little bit more easily. So that is all through here. Typically we talk about iliopsoas, but there's actually some other muscles that end up contributing to some of the reasons why you develop that snapping hip. Iliopsoas is the big hip flexor. But then if we're thinking about then the other muscles that can cause it, it's actually a little bit of this TFL and IT band. This shortening here, again, prevents that hip from kind of moving the way that it's supposed to, as well as the glute max, which is back here, also here, and some of these hip rotators. So the whole idea is that all of these muscles that end up going around the hip joint end up preventing it from really being able to move the way that it's supposed to in that ball and socket joint. When we talk about internal snapping hip syndrome, what we're talking about are things that are within this joint capsule. So here is all this connective tissue that goes around the two bones. Some of this musculature that I was just talking about, that goes over top of this and over to the side. So over top of it is that iliopsoas, and then to the side are those muscles like the TFL, IT band, glute max, and glute med, and those external rotators. But now if we take away this joint capsule, now we're looking inside. This labrum is this piece of cartilage that surrounds the ball portion, the acetabulum of the pelvis. What ends up happening sometimes is this can get kind of frayed, or a whole piece can kind of come off, and that's what prevents that hip from really moving the way it's supposed to, and then that's what causes pain and also that snapping sensation. When we take a look at this x-ray in order to look at the internal snapping hip syndrome, here's that femur, the thigh bone. So here's the ball right here. Here's that outer portion of your hip. And then here is your pelvis. So the femur goes inside of this portion of the pelvis, which is exactly this right here. So this line is this line. What you'll see for someone who has snapping hip syndrome that's related to an internal issue, say arthritis or loose body, you might see a change in this x-ray. So it could be that there's kind of this like flattening of the joint. That would be if there's like some type of arthritis. Whereas for someone who has external snapping hip syndrome, you wouldn't necessarily see it. You'd see like, oh, okay, this is exactly how it's supposed to be aligned. It's kind of like moon shape. But because again, on an x-ray, you can't really see that soft tissue. If you did have an MRI, now again, this is an x-ray. If you did have an MRI, that labrum, which is kind of along here, you might be able to visualize that there's a tear there. But what you won't be able to see on an MRI is some of the shortening of that iliopsoas or that TFL and IT band or glute med or glute max. So what ends up happening a lot of times is orthopedists do a really good job of knowing what they can do structurally. So that's when we were talking about the joint degeneration, labral tears, loose bodies. So something that you can see on an image, right? Now, what happens though with this like external snapping hip is that it's a lot more is like a clinical presentation. So you're not going to see that on an MRI, for example, certainly not an x-ray. So that's what makes it a little bit more difficult to diagnose. And then also the thing is that like us as people who treat people with musculoskeletal issues, we end up seeing a lot more of like, how can you manage this in a non-operative way?
Yeah, exactly. So at the core of Mobility Doc, we're always looking at how do we not only just rehab injuries, but achieve like sustainability for wide spectrum of age groups and activities. And interestingly, one of the more common things when you look up what can I do for snapping hip syndrome, and if it's from like generic medical website, it's going to tell you do nothing, stop, put ice on it. Then they'll say surgery. But for external snapping hip, of many, many tens of thousands of patients, we've never had anyone that's the direction it went, although it is what you'll see online.
Yeah. Interestingly too, I've even had patients that they do have a slight labral tear and they have snapping hip, but some of the pain that they're having is actually related to those external muscular factors. So once we worked on all of that musculature, then they no longer have pain, but they still do have that labral tear. So it's really important to be able to kind of tease out those pieces.
So a large variety of people in general are going to experience snapping hip at some point. Even if you're a non-athletic, regular person, a NARP, just being in a seated position for a long period of time in a day can be a good enough reason. But also there's a variety of athletes who might experience this, such as?
What I see most frequently would be some type of dancer, and then also someone who does some type of like martial arts.
Hurdlers, high jumpers, anyone that's like really having to lead with a leg that like drives up significantly.
And some of that is just based on the ranges of motion that they have to go in pretty regularly, and then some of the demands on that joint.
But for your like everyday worker, I've actually seen snapping hip with people operating high pressure hoses and like leaning into that hip, whether it's like a manual car wash situation, firefighters, anyone that is like finding themselves having to like lean into one direction over and over and resisting some other force. All right, let's take a look at one of our more favorite primers for correcting snapping hip syndrome. You're going to do this for 3 rounds. We're going to show you how to use a hyperized minisphere for your psoas and for your glute and IT band. We're going to show you a modified version of the dead bug to retrain your core and your pelvis and your hip as it moves. And then we're going to show you the standing hip circles and how you can use those 3 to fix your snapping hip.
To release the musculature around the hip, I am going to use the hyperized minisphere. I really like this because it has a little bit of rubber, so it's not going to slide out of the way. It also has a vibration feature, which is nice. But most importantly, it's a perfect size to be able to get into all that musculature around the hip. So if I'm going to release those muscles that I was talking about, we need to do the iliacus, which is kind of right on this inside part of the pelvis where the iliopsoas inserts, as well as the musculature on the side, so that IT band, glute med, and glute max. So first, to get started, we're going to place the ball just right above where that hip crease is, and you're just going to just try to hold that there, kind of going along the line of that inside portion of the pelvis. You'll feel it because it probably doesn't feel great, and you want to try to like just breathe into it. So it shouldn't feel like you can't breathe at all, but you want to just hold it there. You don't have to worry too much about rolling too much, kind of like how you would for foam rolling. So you're going to hold that there for 30 seconds. And then when you come onto the side of the hip, now we're working on this musculature that's just below the crest of the pelvis. So I'm going to kind of come along the side here. So I'm going to come on my side, actually is best, and I'm going to place that ball down right where that musculature kind of comes along the side, and you'll really be able to feel that. Now again, you want to avoid any bony area, so you're just going to just hold that there. Again, you don't really have to roll that much or anything like that. You're just going to hold it in place. For this modified dead bug, we're going to focus on letting our hip get to the point just before where you start to feel that snapping sensation and then pulling it back. That's going to be really helpful for teaching yourself kind of how to retrain that musculature. So I'm going to start first with my legs up. I'm going to put my hands on my pelvis because that's going to kind of give me a little bit of what we call like tactile feedback. So I'll feel with my hands a little bit of what that musculature is doing. The other thing is that I'm putting my pelvis in a neutral position. So I'm not totally rounding, I'm putting myself in a neutral position because this is more functional. So I'm going to start by straightening one leg and then coming back and then alternating back and forth. Now, the thing though is that what I'm doing is I'm just going to go to the point to where I kind of start to feel it. Sometimes people will feel it kind of clunk, sometimes it will snap, pop. So I'm just going to that point. I have this on my left side, so that's why I have to keep my left side a little bit higher when I extend my knee than the other side. So if you can go even a little bit lower and totally straight. But on my left side, I can't really do that. So this side is going to be a little bit higher as I do that. The other thing that's important too, because we're trying to strengthen some of that core musculature and improve our pelvic stability, I want to make sure that my knees aren't past my hips. I want to keep my knees directly over my hips in order for me to have to work on a little bit more of that core stability. You're going to do 10 repetitions on each side. Again, only lowering to the point and only straightening the knee to the point where you're just before that snapping sensation. For hip circles, what we're going to do is we're going to teach our hip exactly how it can move in the different planes of motion of the hip. So you're going to start by standing on one leg as upright as you can. Lift this knee up to 90 degrees. So this is hip flexion. Then I'm moving out into abduction. Now notice that both sides of my pelvis are still pointing forward. Then I'm going to turn my foot back, bring this leg back as much as I can, back down, and then forward. So I'm moving out to the side, and you see how, notice when I turn out to the side how my whole pelvis is going to turn. I'm trying not to do that. And then turn and back. So it's like I'm creating this circle with my hip. Only go though, especially with this turning back kind of motion, only go as much as what your hip allows for you. So if it kind of feels like it's tightening or it's starting to snap, then you don't have to turn it quite as much. So only go in the range of motion that your hip is allowing you to. This is going to teach it how to progressively move a little bit more. You're gonna do 10 repetitions on each side. Snapping hip is an indication, if we're talking about the external snapping hip, actually even the internal, it's an indication that something is off with your mechanics. So meaning that the musculature that's in the front of the hip, the side, the back, it's not exactly working in a coordinated way to make sure that your hip can kind of like move in all of the range of motions that it's intended to. So what you have to do then is you have to try to address any type of like inflexibility, stability, strength issue that's happening, and also do that in an organized fashion in order to address the underlying issue.
Be sure to like, share, subscribe, help us to help more people, help us to help your friends, help us to get our message out there.